Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Like all of us, good heart health is essential for every pet. On today's show, we will look into causes and treatments for heart ailments in our furry friends. And as always, we are here to answer your questions. All that and more coming up on this episode of Ask the Doc, No Appointment Needed. Hello and welcome to Ask the Doc, No Appointment Needed, the show where the questions you send in are answered by our doctors and medical experts. I'm Dr. Joy Carter, Doctor of Veterinary Medicine, and thank you so much for joining us today. Let's get right to your questions, guys. All right, our first question comes from Victoria, who emailed us and asked, "Hi, Doc. I recently took my 11-year-old Pomeranian to the vet for his checkup and was told he could have a heart murmur and an echocardiogram is needed. What is a heart murmur exactly?" Victoria, thanks so much for writing in. Heart murmurs can arise in dogs for various different reasons, okay? But one of the main things is it certainly can be congenital, so it means they're born with it, or it certainly can be kind of acquired because of acquired heart disease, okay? Some common causes that we can see of heart murmurs can be kind of, congenital defects, like basically something wasn't, made the way it was supposed to be or formed, I guess, with as far as kind of like an abnormality, like a birth defect, okay? Certainly there can be issues also with the valves, okay? Your valves are what open and close in the different chambers of your heart. And then there also can be an issue with heart muscle disease. There's certainly conditions like hypertrophic cardiomyopathy, dilated cardiomyopathy, things like that. Less likely causes for heart murmurs can be sometimes infections, things like endocarditis, which is basically an infection of the heart. That could certainly be something that could cause it. And then sometimes you could have a heart murmur. It could be because of systemic disease or disease in other parts of the body. In particular, if a pet is anemic, that blood flow is going to be very turbulent because there's not a big blood volume. And certainly I could hear murmurs in pets because of that. Definitely if a cat, which we tend to see this in cats, if they're hyperthyroid, their thyroid levels are too high, you can see it because of that. And also, sometimes, which is not very common, but maybe like a fever type of thing. So the best thing to do, okay, is if when your pet has been diagnosed with a heart murmur, is follow the advice of your veterinarian, okay? Some common symptoms of having like a heart murmur or having heart disease, I guess you could say, is going to be things like coughing, sometimes difficulty breathing, fatigue and lethargy, kind of weakness or even collapsing episodes, or what we call like syncope. Sometimes poor appetite, because if your heart's not pumping efficiently, like you're going to be very lethargic and you're not going to want to eat. You're not going to want to do anything. Definitely rapid breathing, or what we call tachypnea, fainting, which is also kind of known as syncope, and things like that. So the thing is definitely when your pet has a heart murmur, all that it means is that it's an abnormal sound. The normal lub dub that we hear, lub dub. When they have a heart murmur, is kind of love swished up. So we hear this extra swooshing sound. Okay. Now, it doesn't necessarily mean that your pet has active heart disease. Okay. But you need to have your pet checked out by your vet. Usually they're going to do a few tests. First thing they're probably going to do is maybe what's called radiographs, okay? And there is a newer test that is out there. It's called proBNP. So it is a type of kind of like a hormone or like a marker. You tend to see it levels elevated in the blood when there is excessive stress or stretch on the myocardium, which is a muscle of the heart. And that is a test that can be sent out to a lot of different labs, very easy to do. You get results back in a day or two. Doesn't take very long. If those levels are elevated, then that could indicate that your pet does have active heart disease. And then at that point, then an echocardiogram, which is an ultrasound of the heart, is going to be recommended. Okay. Thankfully, we do live in South Florida and we have a lot of wonderful, great board certified cardiologists. Yes, there are cardiologists for your dog and for your cat. Certainly that can, take a look at your pet. Also, sometimes too, because a cardiologist in this area, these guys are very, very busy, and sometimes it can be months out for an appointment. There are a lot of companies that will do actual echocardiograms. So they come to your hospital, they do an ultrasound of the heart, they send those images out to a board certified cardiologist that is somewhere, else in the country, or even sometimes in Canada, and they will write a report. And then that report will come back to your veterinarian and will obviously let you know what is going on with the heart, how advanced the heart disease is, and then kind of what the recommendations are as far as medications and things like that. Okay. So the best thing for you to do, okay, Victoria, now that your dog has a heart murmur, is just follow the advice of your vet. Okay. Probably they're going to want to start off with the chest radiographs. They're probably going to maybe want to do the pro-BNP. If there's no evidence of heart enlargement and the pro-BNP comes back at a normal level, then probably you're just going to monitor. Okay. And if things start to get worse with your pet, any of those signs and symptoms that I talked about a little bit earlier are noted, then that's when probably the echocardiogram is going to be recommended. All right. So our next question comes from Wanda, who emailed us in, and she says, all right, hi, doc. I have a boxer and I heard that they have a life-threatening arrhythmia that can cause sudden death. What is that? And can I do anything about it? I'm really, really worried about my baby. All right, Wanda. Okay. So certainly, yes, there is a arrhythmia that can happen in boxers. We call it like boxer cardiomyopathy, but the actual kind of medical term is like arrhythmogenic right ventricular kind of like a tachycardia. So what this is in boxers, it is a type of an arrhythmia. Okay. It tends to be what we call a tachyarrhythmia. So a really fast heartbeat, and it can progress from being just what we call tachycardia, so a fast heartbeat, to something called ventricular fibrillation. That is basically where your ventricles, which are one part of the chamber in your heart, they just kind of, they're not contracting like they should, kind of like this, and they just kind of flutter. And when that happens, blood is not being pumped efficiently to, the organs, to the lungs, to the part of the bodies and everything like that it needs. Unfortunately, if a pet does go into ventricular fibrillation, it can be deadly. Okay. Usually to get them out of VFib, they have to be shocked. Okay. Which a lot of animal hospitals, particularly your specialty hospitals, now do have, the paddles like they have in the human hospitals, basically the defibrillators to try and shock them back. The unfortunate thing with it also too is that a lot of times you don't even know that your pet has this condition or can have this arrhythmia until they basically have an episode and kind of go into sudden death and pass away. Okay. It doesn't happen that often, but it certainly can. All right. If you are really concerned about your boxer, or there's any history of any type kind of syncope episodes or collapsing or exercise intolerance, other things like that, then I highly recommend, take your pet to the vet. And an echocardiogram may be needed. All right. Just to kind of see if maybe your pet could potentially have this. There are some medications that they can be put on. They're typically basically kind of beta blockers that help lower the heart rate type of thing. So I hopefully, Wanda, your baby does not have this, and I don't want to scare you, but yes, it is something that can happen in particular with boxers. And sometimes we don't even know that they have it until all of a sudden they just suddenly pass away. But like I said, if you're very concerned, let's get a checkup, with your veterinarian, express your concerns, and then maybe see about getting an echocardiogram. All right. So our next question comes from Andre, who asks, my vet recommended that my indoor outdoor cat be put on heartworm prevention and medication. I thought only dogs get heartworms. All right, Andre. So, no, it has now been found out that your kitty cats can get heartworms. It is not as common, okay, as it is in the dogs, because most of our cats are going to be inside. So they're not exposed to mosquitoes quite a bit as your dogs. But cats can certainly get heartworm infections. Now, the thing about heartworm infection in cats is it can be difficult to diagnose. Usually they have a low burden of worms. So what that means is they don't have a large amount of worms that basically get lodged in the heart and the pulmonary artery, unlike dogs. Dogs can have hundreds of worms. Cats, usually it can just be like one or two. The other problem is usually they're what we call same-sex infections. So you have basically a male heartworm and a female heartworm, and then they produce baby heartworms, or what we call the microfilaria. So in particular, in cats, you can tend to see infections that are just male heartworm. The problem with that is it makes it very difficult to detect if they have heartworm, because what we call kind of like the snap test that we tend to have over the counter or at your regular vet's office to diagnose them, they detect basically the female heartworms. And if there's not any female heartworms, you could get a false negative test. There is a new test out there that can be sent to the lab. It is called like a heat antigen test that is pretty accurate. So if your vet has a suspicion that your cat could possibly have heartworm disease, and the SNAP test is negative in-house, they will most likely want to send this test out to kind of confirm. Now, the sad thing is there is not really any treatment options or good treatment options for heartworm in cats. Okay. The medications that we tend to use in dogs, which is basically like aminicide that kills the adult heartworms, is toxic to cats. So we can't do that. I have heard before, and it's very rare, and it's not something that's done very common, is they actually go in and surgically remove the heartworms from the heart. But that's very, very expensive. That is required. This is going to be like in a university type setting or in a very large cardiology practice. And it's not something that's typically done because there are a lot of risks, as you can imagine, with kind of almost doing open heart surgery, with your pet. So definitely having your cat on prevention. Okay. A lot of the preventions today, such as Revolution, Advantage Multi, I can't remember all the names, but a lot of the flea and tick prevention for cats also will help prevent heartworms. And it's so very important in them to have them on it because, like I said, there is not treatment for that. Now, for dogs, there is treatment, okay? And dogs with heartworms, the infection is a little bit different. They tend to have a large amount of worms, basically, that live in the heart, that live in the pulmonary artery, and can even start to migrate into the lungs. And typically, dogs will also produce what we call the baby heartworms or the microfilaria that you can pick up a lot of times on like a blood smear. The treatment, you want to protect your dog too, just because they can be treated for it. The treatment is expensive. I would say on average, probably anywhere from $1,500, maybe to $2,000. It is a series of 3 injections that are given basically a month apart. The whole entire heartworm treatment, it takes like close to 6 months because you have to put them on some medications and some steroids first. Then you wait a couple of months and they get their first injection, and then you wait 30 days and they get their second and a third injection. And there's always risk with this treatment. When those whole adult heartworms die, they're basically like an embolism, like in the heart, and they can basically go to other parts of the body and they can clog an artery and they can be 100% deadly. They can actually cause like an anaphylactic reaction, different things like that. So yeah, these heartworms act as emboli and they can certainly cause problems. So definitely in your dogs, just like with your cats, it is 100% preventable with a proper prevention, and you want to keep your pets on that. Okay. All right, we just got a question from Robbie, this time from our Facebook page. And he writes, our family lost a great friend when our brother-in-law's dog had to be put down because he had fluid around his heart that they believe was caused by a tumor. Can dogs get cancer of the heart? And how common is that? So, unfortunately, Robbie, yes, dogs can get cancer of the heart. In particular, the two most common types of tumors that we see. The first one is hemangiosarcoma. This could also affect other organs. It could affect the liver. It could affect the spleen. But when it affects the heart, it's not very good. And most of these tumors, are not good to have any type of tumor on their heart. But what tends to happen is these tumors will bleed. And your heart is contained within a sac. The sac is called the pericardium. Okay. And when fluid builds up, it builds up inside of that sac. And if enough fluid builds up, they can basically have a crisis, what we call cardiac tamponade. It is basically where the heart cannot pump efficiently because of all that pressure from the fluid. So think of it like a rubber band that's being squeezed around the heart. That fluid is putting pressure and it's squeezing the heart and it can't pump. A lot of these dogs that do come in cardiac tamponade are very, very unstable. Okay. There is things that can be done, and they're kind of like emergency life-saving procedures. In particular, there's something that can be done called a pericardiocentesis. So we stick a needle through the chest into the heart sac, and then we drain that fluid. All right. Most of the time, this is just a quick kind of temporary fix to get your pet more stable, to then be able to get other diagnostics done, which in this case, an echocardiogram is going to be needed to be able to diagnose if your pet does have a mass or a tumor on the heart. All right. The second most common type of tumor that we see on the heart is called a chemodectoma. From what I remember, this tumor does tend to be a little bit more slow growing. So it has a little bit better, I guess you could say, long-term prognosis and things like that. Also, another thing that you can see is mesothelioma. Okay, you guys know those commercials on TV all the time. If you've been exposed and possibly have mesothelioma, well, it's a little different in dogs. They don't get it from the same place that humans do, but certainly that is another type of tumor. In particular, I had a case where a dog had mesothelioma of the actual pericardial sac, and that was causing fluid to build up in the pericardium. And this lady actually went and she did surgery. So they basically cut a window in the pericardium, okay, that sac of the heart, to be able to have that fluid drain so it didn't build up. I think overall, long term, I don't know how long the dog lived, but it did give him like a few more months. Okay. I'm so sorry about, your brother-in-law's dog. The good thing is there are cardiologists out there. I definitely have seen pets with hemangiosarcoma who, have lived, maybe not as long as they normally would have if they didn't have the cancer, but definitely they have had a few more months and things like that, and a good quality life. So there are definitely some options out there. It is, it's common, but it's not common. Okay. In an emergency setting, I tend to see like dogs that come in with pericardial effusion or cardiac tamponade all the time. But the good thing is we really don't see heart tumors that often, as far as, the different types of cancers there are out there for dogs. All right. So Beck followed up with his email and he writes, hi, Doc. I have a purebred ragdoll cat, and I was told by a coworker that purebred cats are more prone to heart problems. Is this true? And if so, is there anything I can do to protect her? All right, Beck. So yes, that is 100% true. So cats, and as far as heart disease, it's a little bit, cats are just different animals to begin with. They don't show the typical clinical signs of heart disease like dogs do. All right. Certainly things you can see can sometimes be a little bit of persistent cough. Definitely weight loss or decreased appetite is one thing that we'll tend to see in cats. You can see some syncope or collapsing episodes, but really don't see those that often unless your cat is having like some type of weird arrhythmia. Definitely these signs and symptoms can come on very rapidly. And sometimes the only thing that owners notice is that all of a sudden their cat is breathing very rapidly, or they're using like their abdominal muscles or breathing very heavy, things like that. Okay. When you notice things like that, you definitely want to take your cat to the vet. You don't want to just sit around and wait, okay? Because cats, a lot of times, they can have heart murmurs, but a lot of times they don't always have heart murmurs to tell you that, hey, something is going on. And in particular, the purebred cats for some reason. So your ragdolls, like you have back, okay, your Persians, your British short hairs, breeds like that for some reason, or your Maine Coon, that's another big one. They are predisposed to having heart disease. Now, things you can do to try and kind of detect things early is I talked about that pro-BNP test. Okay. So they run that in dogs. They also run that in cats. A lot of veterinarians are using it as a screening tool on yearly blood work. And that is definitely something with you having a purebred cat. I would recommend every year when you go in for the yearly checkup with your cat to have your vet run that test. It can be sent out to the lab. And like I said, if it starts to come back elevated, that is then when you probably want to see about getting an appointment with a cardiologist or to see about getting an echocardiogram. Okay, with like another company that comes in and does ultrasounds to kind of screen for heart disease. Because I've seen a lot of cats, unfortunately, come in that owners had no idea they had any type of underlying heart disease. Chest x-rays look normal. They've had EKGs and that was normal. And they come in and they're basically, all of a sudden in congestive heart failure. Okay. So cats are a little bit different. They tend to get something called hypertrophic cardiomyopathy. That is the main thing that they get. There's some other things. There's dilated cardiomyopathy and restricted cardiomyopathy, but they're not as common as what we call HCM. What happens in HCM is basically the muscles inside the heart hypertrophy or get very thickened. And so you can't really see that enlargement on the outside. So you can't see that with an x-ray. The only way you can see that is with an ultrasound. So that's why it can be very difficult to diagnose heart disease in cats just based on x-ray alone. But the good thing is we have a lot of new tests, that pro-BNP, we have echocardiogram, things like that that are better able to help us diagnose. So definitely go take your kitty cat to the vet. Talk to your doctor about your concerns, and he or she is going to advise you on what they recommend kind of for the next course of action. All right. So Jade emailed in with a question that many of us can relate to. And he writes, my older Chihuahua recently passed away suddenly. And someone mentioned it could have been a heart attack. Do dogs get heart attacks? All right, Jade. So dogs don't really get heart attacks. Okay. So heart attacks in humans typically comes from a blockage from like coronary artery, if I'm correct. Okay. And usually that can be seen in humans because of diet. Obviously, if you're overweight, lifestyle, smoking, drinking, like all that stuff. Thankfully, our dogs don't do that. All right. So they can't really get heart attacks, but obviously they can have different types of heart disease. And without, I'm just kind of, guessing, but it definitely is possible if your dog passed away suddenly in the middle of the night, your pet could have had basically an underlying heart condition that you guys did not know about. If he had not been to the vet recently, or if he hadn't been to the vet and the vet just said, hey, oh, he has a murmur, but just monitor him, type of thing. There is something that can happen called a ruptured chordae tendineae. So your chordae tendineae are muscle fibers that basically hold your valves in place. And when one of those ruptures, that valve is just kind of flapping all over the wind. And these guys could go into heart failure very quickly. And sometimes they could just pass away. I mean, your pet could have even had some type of arrhythmia or something like that. Like I talked about ventricular fibrillation or something like that just could have caused unfortunately, sudden cardiac arrest. So no, your dogs could not get a heart attack per se, but certainly there are definitely some other heart conditions that they could pass away from very rapidly, and sometimes without you even knowing exactly what happened. Okay. So I think that's going to be all for today, guys. Hopefully I helped answer some of your questions and let you guys know how important it is to kind of get your pets checked out and express your concerns with your veterinarian, because heart disease is out there. I see it every single day in dogs. I see it also in cats, and it's definitely very important to get them checked out. So I hope you guys have a great weekend, and I will see you guys on the next episode. So bye.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.